Well, thank you, Gillian, for the really kind introduction. Thank you to the BRCCH for hosting us, and of course also for supporting this project. It's a great pleasure to be here. I will talk today about a study that's joint work with a large team. Most importantly, my co-investigator, Daniel Meusezahl, who is here in the back, and a big part of the team that's online that is from the ETH here in Zurich, from Afinidata in Guatemala, the US, from the Universidad Peruana Cayetano Heredia in Peru, and from the Harvard Graduate School of Education. It's a large team, and I will not list everybody. I will just put the list here so you can take a look. I'm here to speak on behalf of all of them, which is hard because there's lots of different expertise, and I will not do everybody justice. At the bottom, you see a picture from our group reunion last year in Peru, which was amazing. On the top, you see how we more typically meet in front of a screen on our weekly calls to update everybody on what's going on. Today, I will talk about a few things. First, I want to just reiterate a bit on the project background, what drove us, what motivated us to do this project. Then I'll briefly explain the objectives of the project. For those of you who were here when we first presented this in late 2019, maybe that's a bit of a repetition, but it's good to remind everybody. Then I'll show you where we are. It's a 5-year project, so we are roughly halfway through. Give you some results from our feasibility study, which is completed. Talk a little bit about the insights and adaptations that came from that feasibility study, and then talk about next steps and how you can learn more and also get involved if you like. The background of this project is this global number that many of you have seen. There are lots of estimates about percentage or number of children that are not reaching their developmental potential. The number that's often used is 250 million. Is that a big number? Yes, it's a very big number. There are about 600 million children out there. So we're talking about 30 to 40% of children that are not getting where they should be getting, and there is lots of need for improvement. This need has been well recognized in the Sustainable Development Goals. 3 says, well, we should make sure everybody is healthy, and I think everybody here in this room will agree with that. And 4.2 directly also asks for appropriate early childhood care and support. And I think this project kind of falls in between health and development and early childhood care. And in the space of supporting families and parents and children in the first 3 years of life, I think the gold standard today are home visits. I'm not sure how many of you have worked with home visits. These are parenting programs where you have either community health workers, nurses, or some other trained staff go to parents, work with them, provide them maybe some materials, learning materials, toys, and then make sure that the children get the support and also the parents actually get the support they're needed. That's nice. What's hard about this is, of course, that supporting parents in large and especially developing countries is hard. Like you need lots of staff, you need lots of planning, lots of materials. So in practice, we are not reaching nearly as many families as we should right now, and we're thinking hard as a community about ways to do this more efficiently. Of course, when we talk about efficiency, we always talk about new technologies, and I think in low-income settings, the technology of the last decade are, of course, mobile phones, which have appeared everywhere and have inspired many of us, probably also in this room, to think about what else could we do with these cool new devices. And here specifically, we are working with an app that was developed for smartphones that is meant to support parents in low-income settings. I don't think I need to say too much about mobile networks. You all have seen these graphs, like phones have really taken off. And I think 10 years ago, we would say like, yeah, more than half of households now have access to a phone. But I think in pretty much all countries you can think of today, you can say more than 90% have access to a phone, at least like one phone in the household, and I think we can reach them. And I think what's rather remarkable is how fast also smartphones now have taken off. Like maybe not as much yet in some of the poorest parts of Africa, I would say, like where you see smartphones more in the capitals. But I think if you go to Latin America and many parts also of Asia, I think smartphones, maybe not the iPhone 11 or 13 or whatever the latest model is, but like the basic smartphones now are really very present, and more people have data plans now than sometimes have like phone plans. And I think that's quite remarkable. So this specific app we are working with and looking at is called Affini, and the company that runs it, or let's say the organization, the NGO that's running it, is called Afinidata. And it looks roughly like this. It's a combination of text and images, and it has a chat bot that interacts with the parents. So think of a WhatsApp chat or think of a Facebook Messenger chat that kind of contacts you, say, hey, what's up? Like, we have some new materials for you. Check this out. And of course, then it gives parents instructions. And what we're trying to do is to see whether this new app that was specifically developed for low resource settings for families in rural areas with less access can actually help them support the children better. How does the typical activity look like? Well, you turn on the phone, you say like, hello, let's go. Here's an activity for you. You open it and it gives you some instructions. Get some basic toys, sit your child down, talk to your child, play with this, and then essentially have fun and make sure the child gets some stimulation, some ideas, I guess, quality time with the parents. So what we're doing here to see if this works is to run a large trial. Like we are working in over 100 communities that are at the community level randomized to 3 groups. And we're using this RCT to look both at who is reached, how well are they reached, how often are they reached, and then what's the impact of reaching these families with the platform. So there's an aspect of cost effectiveness, but also a big part of the project is reach and equity. I think if we walk out of this project and say, okay, we reached 20%, but they are all already super well connected, that would be a bit disappointing. So the idea is really to see that we can reach those that are most in need of support. It's a mixed methods evaluation. There's a big qualitative part, but the center is a cluster randomized trial. We are working in 3 provinces actually around San Marcos province, where we have our research station and we have 3 arms, the control group, we have the affinity group, and then we have also a home visiting group, which is kind of the gold standard in the field, just to see how large an impact we have relative to a more expensive program where we would send somebody to directly support the parents. What's the outcome? We're going to look at child development broadly at 2.5 years, and we're going to look at impact, equity, and cost effectiveness. How does this setting look like? Here is a nice picture. I think it's beautiful. Like it's in the Andes. For those of you who know more about Peru, it's in the region of Cajamarca, and there, like Peru has the admin level 1 is region, and then it's the provinces, and underneath the provinces is the district. So this is the province level: San Marcos, Cajabamba, and Cajamarca provinces. It's high altitude, it's the lowest. So if you look at the lowland here, it's 1,900 meters. So it's already quite high up, and it goes up all the way to 3.9. So not quite Nepal for you, Amit, but we are quite close. It's, as you can imagine here, predominantly rural, and the rural communities mostly engage in farming. Timeline, I told you already, it's a 5-year study. We started in 2020, the usual COVID delays apply, but they were actually not that bad. So we are roughly now in the middle, year 3. We have finished recruitment of all the participants of the main study, and we're going to start end-line assessments because it's staggered recruitment and staggered end-line assessment later this summer. So it's a kind of important point, an important time point of the study. But today I'm not going to show you the final results. I hope you'll come back for that in 2 years, but I'll show you some things we have learned in the meantime. Okay, so we did a little pilot, as I said, and I think that's what I can show you. For the pilot, we recruited from this entire area random set of families, which we identified through birth records. So we just looked at like, where have children been born recently? We visited them, and then we got 180 mothers that we invited to use this app for a few months, and then we followed them very closely, calling them up, how's it going? How do you like it? Do a feedback, which activity do you like? Which activity do you not like? For the pilot, we restricted to moms that had a smartphone because we, of course, we wanted to have as much feedback as possible. For the main study, we didn't do that, but I'll say more about that in a second. This is just a flow chart. Here you can see a typical field worker explaining how things work on the phone to moms. You can see a clear traces of COVID here. Like you see how everybody is trying to be safe, how everybody is wearing a mask. So first thing we did, of course, to make sure this works in the local context, and a big thank you for doing that to the local team, is to go through all of these activities. Like they're essentially behind this kind of like simple looking chat bot, there is a database of almost 1,000 activities that the machine essentially pulls out and can recommend to the child. And each of them has some text, has some materials, has some guidance. So we had to go through each of them like one by one and say, okay, like, is this doable here? Can moms really find these materials? Do they understand the instructions? And I think that was quite a process. In the end, I think we found a set that was suitable, and we also developed some additional items. The second thing we did, which I think I personally was a bit nervous about, is to go out to these communities and actually see how many communities have enough network connection to run these kind of apps. And then within those communities, what proportion of moms has a phone that's smart enough to see the app. And I think the results of that were surprisingly positive, or maybe it's just a reflection of how much these networks have grown. So out of 142 communities we visited, 136 had enough network to run this. And that's, to me, amazing. Like, if you think of how scattered these are. And even within the communities, over 90% of moms either had their own smartphone or had somebody in the household whose smartphone they could use for this. So we thought like, well, maybe we have to restrict the trial to moms who have phones, but not necessary. Like, we could really just enroll a random sample of moms, which I think strengthens the credibility. How different are rural from urban communities? I think for those of you who have worked in these settings, you will not be surprised. So here's just a few things. Of course, the two urban, actually, it's, I think 3 urban centers are slightly more educated. They have slightly fewer like housewife type moms. They are slightly better in reading, and of course, much less farming, but I think it's not a huge difference. What's striking, and maybe also a reflection of modern times, is how much these moms are online. I mean, if we ask them, do you use Facebook? Like, you can see in the cities, 100% say they use Facebook, and 90, what is it for WhatsApp? I think it's 96% in rural and 100% in urban. So people use these phones and are online all the time. So it's, yeah, quite amazing to me. Probably wouldn't look very different in Switzerland, I would guess. So what kind of feedback did we get from this pilot? So first of all, we asked them, okay, like, when we recommend these activities, how do you deal with them? And it's like, well, typically we actually take out the stuff. We take 20, 30 minutes. We engage with the child, which of course we love to hear, because that's kind of what we want. So we take these things and play. We also ask, were there some things that you didn't like? And 11% of moms says like, yeah, well, that stuff, not so cool. So we then asked, like, what did you do? And most moms said like, well, I just clicked next, because in the bot, you can just say, give me another activity, and the system just recommends something else. Yeah, so it's not dramatic, but there were some. And I think overall, moms thought it was very positive. Like, well, this app has helped me, like, find some new games. It really helps me to engage with my child. And in terms of difficulties, very few moms told us that they had issues with not having data, not having phones, and like these kind of things that we thought of in the beginning when we wrote the project. Well, what about if they run out of data credit? Like, what if they don't have a phone? What if the phone breaks? Very few moms reported that. So it seems like access to the internet, maybe because they care so much about Facebook and other things, seems to be kind of like a stable feature. We also asked for some quantitative ratings. Did you ever use the Fini? Almost all of them said, yes, I gave this a try. Did you find it like a positive experience, useful or very useful? Almost everybody says. Of course, we asked them, so maybe this one I wouldn't give too much interpretation. Like, did you like what we gave you? Sure, we liked it. So do you plan to use in the future? And they also like, yes, I will. So this is super positive. I'll show you the actual use in a second. That's not quite as positive, but it's always nice to hear people say that they like what you offer them. So then a few things that they said, like, you could improve, and one of them relates to the activities. There were some comments like, well, some of the text is too long, it's too complicated. Some of the activities you recommend, like, we don't have that kind of material, so please take them off. And like, we try to accommodate that. They said like, well, you know, when we asked like, why didn't you use it more? I guess the answer we got is what I would have given as parent, and other parents would give just like, sorry, I don't have more time. The most common constraint is really like, would love to play more, would love to all different, but I just don't have time. And some parents would say like, well, you know, I lost my phone, or the phone got used by somebody else. And then the tricky part is like, because there's a unique login into the system, what we hadn't anticipated is like, once you change the phone, they kind of lose the link and the connection. And sometimes we just lost them. Like, once they got locked out, they found it hard to log back in. And we tried to address that with some modifications of the enrollment. And during COVID, of course, they also like, sometimes they would actually have to have more materials. Can we get more activities because we're all home now? And yeah, sometimes moms are like, well, we have a phone, but it's hard for me to access because during COVID, especially, my child is using it all the time. So I have access physically, but I can't really use it because it's used by others in the household. So then I mentioned already, and I think that's the part that we are still working on. What's the actual use? You know, it's nice to say, like, I like this app, and I'm guessing everybody in this room has a smartphone, and I'm sure you have lots of apps on this smartphone, and I'm sure you like all of these apps, but there are some that you use all the time and some you barely ever use. So the question is, like, how can we get people to use the app, and how many people do actually use? And here you can see some timelines. So in the x-axis is time since enrollment in months. And of course, in the beginning, it's mechanically 100% because we enroll them and you're in. But you can see even within the first months, we lose 20%. So these are people who just, like, we sign them in and they don't care, like they don't ever come back. And then in the second months, we lose like almost like another 20% who maybe try it and then go. And then it kind of flattens and like stays around 50, 40% with some up and downs. Like I would say after half a year, we are at about 45% or so, depending on the region. I think I can skip this. I don't see the time sign. Okay, perfect. 5 minutes is perfect. Good. So it's actually, we also thought that maybe it will be much harder for rural or less literate moms. We don't see any difference. Like this usage pattern doesn't seem to be very strongly correlated with like literacy or residence. It's more about time and interest. So of course, what we're struggling with, and Andriana could talk a lot about that. So Andriana is the person who developed this entire operation, is like to get the users engaged without pushing too much. So with the system, so if this is too small for you to read, this shows the number of users accessing the system every day. And you see two patterns. Like one is that people don't generally use the app on the weekends. The weekend is kind of other family activities and they don't engage. So most of the activities during the week. So weekend, like you can see, like and the yellow is when the app pushes something. Hey, what's up? We have new content. And you can see that that increases the chance of people engaging by about 40%. I'm sure you get these pushes as well. Like, well, hey, check in, like we have some exciting news for you and these kind of things. The flip side of that, and I think something we struggle with, if you do it too much, users block you. So there's this like very subtle balance of I'm nudging you until you get annoyed and then you shut me down. So you have to just nudge a little and then pull back and okay, just checking. Okay, sorry, I didn't mean to push too much. Okay, so just a few things on adaptation, and I think that's related to feedback. So one is this re-enrollment option. So we gave them like a booklet, essentially gave them instructions. So in case you ever get locked out, this is how you can reconnect to make it easier. And we also developed over time other channels to connect. So in the beginning, when we started, this was all Facebook Messenger, but now there's also a channel through WhatsApp. So you can get the same content through a WhatsApp group. And there's also an independent app that you can install on your phone, and then you can click on the app and access the same content. So right now, there's 3 channels through which people can access, and we are measuring which ones they prefer and which one they will converge to. And we also have a few users that use all of them right now, but we'll see how we do. The ETH team with Lionel also worked lots on the system. Like we're trying to improve the chatbot. So if you ask questions like how well can the chatbot respond, I think in the era of ChatGPT, everybody's excited about these language models and they get better and better every day. But we also try to have like a better recommender system. So if a child who is 15 months old and who has like done 15 activities, what is the best activity for that child? So there's like a complicated algorithm being developed and tested right now that tries to find the best possible activity just to make it more fun for the parents, the child, and of course also potentially get a bigger impact. Good. So what have we changed for the big trial? As I said in the beginning, we were quite nervous about phone access. Like, can we really work with the full population, or do we need to truncate the population? Do we need to select? And I think the only selection we had to do, we had to leave out like 3% of the communities just don't have access. So those are out. Everything else is pretty much it. So it's a random sample of 97% of the population, which I think is quite cool. What we underestimated is how many moms are covered by the national program. Like we thought it's maybe 20, 25%, but it was closer to 40, 50%. So we put them aside, like we didn't want to interfere with the national program. And what we did instead is sampling randomly from them to see how effective our 2 interventions are compared to the national program. Just so we have another benchmark. And then the last point, we are of course nervous about this dropping to 50%, 40%. Like we want to see impact. I think we want the users to stay engaged. So we have tried some small data rewards. So if you access the system at least once a month, then you get a small reward, and we're testing how effective this is. Perfect. So this was the original trial design. There's just two modifications. Once we've added this external reference group, and second, we are testing like how much engagement we can get by giving data rewards. Almost at the end, just to show where we are. For the study, we have finished recruitment. We have recruited 2,450 families, which I think is quite amazing. Thank you again to the team in Peru. That was a lot of work. They are here geographically. You can see the clusters. You can see these are the three provinces that I mentioned. And if you want to see the shot from above, you can see it's really like mountains, and the clusters are scattered everywhere. And the color, you can see the cluster level randomization. So we have clusters of all groups in all the areas, which I think is quite nice. Next steps. Well, we are getting ready now for N-line, which of course is always the scariest point in time. We are developing the tools, we're doing some validation, and then we hope to do the first N-line assessments in July this year. That will continue until the end of next year, and then in 2025, we'll be back here to present the final results. That's it from my side. Thank you so much. Please contact Daniel, me, or anybody else in the team if you have questions. Thank you.
Maybe just one clarifying question. So we had a question from the virtual audience about the outcomes of the trial. So maybe just to clarify, what would the outcomes of the trial as opposed to the pilot be?
Yeah, perfect. Thank you for the question. The main outcome will be a broad measure of child development, which was just launched recently. It's called the Global Scales for Early Development, which assesses children's broad development in the domains of language, cognition, and socio-emotional development. It's a single score that's constructed based on assessment that's about 45 minutes. So it's, for those of you who work in child development, it's kind of like a simplified version of the Baileys. So it was meant to be doable by a lay field staff essentially, but does the same things like building blocks and like these kind of broad assessments. Yeah.
Thank you.